So it's really lovely to welcome Dr. Yanan Zhang, who's going to give today's presentation. Yanan is a quantitative research fellow at the Oxford Institute of Population Ageing and a research associate at University College Oxford. Her research involves the creation of an evidence base for positive interventions in support of population ageing. She previously worked as a social care economist for the ESRC-funded Sustainable Care, Connecting People and Systems programme. Yanan conducts research on the costs of social care in terms of economy, health and well-being, primarily through the analysis of large-scale longitudinal survey data, often presenting her results internationally, directly contributing to key policy debates. So we're really happy to have Yanan with us today before she jets off to China to present her work to an international audience. So as you can see, Yanan's presentation is the impact of son or daughter care on Chinese older adults' mental health, lessons for the future of care in China. So over to you, Yanan.
Thank you so much, Magella, and thank you so much for the Center for Care inviting me for this seminar. It's really a great pleasure. So as Magella introduced, I have been working with the Center for Care and the Sustainable Care team for quite a few years. So I worked with Matt between 2018 and 2020 as a social care economist, evaluating the cost of providing care. And now I'm still working with the Center for Care team closely as an associate member. So now I'm working with Maria, Jingwen, Gwilym, Matt and Charlie and Daniel, and currently we also work on a couple of projects. So today I would like to speak something slightly different from what we are doing with the Center for Care team. So this is about the association with the care source and the care recipient health, the subject well-being, and this is specifically in China. So this work has been done with the collaboration with Professor Sarah Harper, who is my current lab manager. And some of this work has been published already. So at the start of this presentation, I would like to briefly introduce the background of adult care in China. So in China, family care is the primary means of adult care in China. This is due to the traditional cultural norms as well as the underdeveloped social welfare and long-term care system. On the cultural norms aspect, China is a patrilinear society, and it has been profoundly impacted by the Confucian custom. So while the filial piety is valued as the core virtue, children in general, especially sons, expect to respect and support their old parents and feeling this filial piety. And this was even right in law since 1996. Yes, that means that in the law, the children are required to look after and care for their old parents. So as for the underdeveloped social welfare and long-term care system, it has been characterized by a lower level of benefit for healthcare and pension schemes at the moment, and there are limited provisions of care service. In general, this type of formal care service will be very expensive. Under this type of the background, the sons in this culture are different from daughters. As I say, China is a patrilinear society. Only sons are allowed for the ancestor worship and to carry the family lineage. The sons and the family also are expected to provide financial, instrumental, and emotional support to their old parents. To exchange for this older care, the Chinese parents in general invest a lot of the money in their care's well-being, which including their education and their wedding, and even buying them a house and looking after the grandchildren for their son. And some of the families, especially in the traditional China, and the sons are even monopolized the right of inheritance. But the picture of the daughters are totally different. In the traditional China, women were usually not financially independent, and the married women need to be responsible for the neighbor-based household chores, for their new family and their parents-in-law to exchange for the support to meet their basic needs. For this reason, the natal parents never expect any financial or instrument support from their daughters, and usually only one small type of the monetary support they will give to their daughter. So that is the dowry and the marriage. However, the low fertility rates and the urbanizations change this sustainability of traditional system. This is more specifically is caused by the one-child policy, which reduced the household size and the availability of the sons. So we can see from the data, the average household size was 5.3 during 1920s and the 1940s, and which was reduced to 3.09 in 2010. Another important factor is urbanization. A large proportion of the rural adult children, they have to seek job opportunities in the urban areas and leaving their old parents behind. So in 2012, there is data shows that the estimated number of the left behind old parents in rural China was about 50 million. So on the other hand, the modernization and the economic development bring women's empowerment. This is because more and more women participated in the non-agricultural jobs, and they start to contribute to the household income financially as well. And during this process, the women empowerment process, the daughters obtain decision power in marriage and gain the financial capability to support their natal parents. So this is a very brief introduction about the population aging in China. And we can see at the left-hand side, the figure 1, which discloses the old age dependency ratio between 1990 to 2020. And we can see that in 1982, the number is about 8%, but when we go to the 1920, it goes to 19.7%. So, sorry, the old age dependency ratio is defined as the proportion, the population of the people aged between 65 and over to the group of the people who aged between 16 to 64. So the target healthy aging sits on the top of the government's agenda. And at the same time, the accessibility of the good quality of care is of great concern. At this background, there is increasing popularity of the parents receiving support from their daughter's family. And a lot of the study has investigated the types and amount of the support provided by sons and daughters. So when we talk about the type of support, the literature in general categorize the support into financial support, instrument support, and emotional support. When we look at the financial support, we actually find the inconsistent results. But most of the literature shows that still sons are more likely and provide a higher level amount to their parents. So I will not go through this literature one by one, just to give you a brief idea of what's happening here. And when we go back to the instrument support, again, there is no consistent results about who provide more instrument support, but there is a growing trend to show that there is growing number of the daughter involved providing care to their later parents. So that's what we find in the literature. However, when we go to the emotional support, the number of the literature on the emotional support is much limited compared to the literature on the financial support and instrument support. However, within this limited literature, the results consistently show that the daughters are more likely to and better at providing emotional support. So those literatures is largely focused on comparing the types and amount of the support provided by daughter and sons. Much less is known about the difference in the experience of the parents who receive care from sons and daughters. So here are some examples who look at the health outcome of the adult care provided by daughters and sons. And among them, Professor Zhang their team have two papers one is looking at the satisfaction level with the support for activity of daily living provided by the daughters and the sons family. And they show that the old parents are more likely to be satisfied if the care is provided from a daughter's family. And in another paper, the professor then investigated the quality of the emotional care. So they found that the old parents whose primary emotional caregiver is a daughter or son-in-law associated with lower level of mortality rates and a higher cognitive capacity than those who are cared for by a son or daughter-in-law. And also, some of the paper looking at the likelihood of reporting unmet needs in the ADL support. And they found that among the urban parents whose primary caregiver is a daughter, they have a lower level of the likelihood to report an unmet need compared to the group of parents who look after by their son. And another paper, which is by Ten and Short 2008, they found that coexistence with a daughter is actually associated with a higher level of mental well-being compared to the coexistence of a son. So this group of the literature actually shows a daughter advantage in providing adult care. And those group of the literature provide some explanation for the daughter advantages. And the first one is the stereotyped gender norm that people always believe women are better at caring. So in other words, the daughters are better at providing care compared to the sons. And another famous conflict behind it is that in China, it's quite common, documented. They always have the arguments between the daughter-in-law and the mother-in-law. So for this reason, in the families, son's family, it is generally the daughter-in-law who provide the care. So they believe the care provided from the daughter-in-law probably not as good as care provided by the daughter. So the literature in general use these two explanations for the daughter advantage they found in providing care. Also, the literature also shows that there is some advantage in providing instrument care. One of the paper is from the Tong and Silverstein, and they find that there is a stronger positive well-being impact of care provided by daughters-in-law than by daughters in the rural Anhui. And their explanation is that the cultural expectation, if it has been met, it's more important than the care provided itself. So this means the influence of the culture on the mental well-being of the older adults. So there's also other kind of the research does not directly compare the care provided by daughters or sons, but they had exploring the association between the gender composition of the children and the mortality of the parents. And then also, again, the mixed results are found. To supplement this research question, and our paper look at if there is any difference in the mental well-being between the parents who receive adult care from the daughter and the sons in China. So this is a motivation and the background and the research questions for this project. And we set a couple of hypotheses. The first hypothesis is that we believe the Chinese parents' well-being is largely dependent on the filial piety and the adult care provided by the children. But we have the strong cultural norm and the strong son preference and the gender difference in the socioeconomic status, which means that the men in general have a higher income than women, and the sons are more financially capable to provide better health care and social care to their parents. Therefore, we formulate our first hypothesis that the mental health of parents who receive care from their sons will be better than those cared for by the daughters. And our second hypothesis is relevant to the regional difference. And as we say, in China, we have a significant difference in the urban and the rural area. The inequalities in the availability of the son, access to the healthcare and the social security and education, economic development, and other micro factors are huge differ across rural and urban areas. And in general, in the rural areas, there is a stronger son preference. And there is a more significant gender gap in the socioeconomic status in the rural areas due to the underdeveloped economic environment. So we believe that the older adults living in the rural area, they probably are more dependent on their children. So we formulate our hypothesis that the difference in the health outcome of care provided by sons and daughters will be larger in the rural area. Our third hypothesis is based on the gender. And we believe that due to the life expectancy and the gender ideology, the men are more likely to receive support from their partners compared to the mother. So in other words, the men are more likely dependent on their the women are more likely to depend on their children. So we believe this difference in the health outcome of care provided by sons and daughters might be stronger among the mothers. And for our last hypothesis, we group the parents with their financial resources. And for the wealthy parents, they're less likely financially dependent on their children, and they are capable to afford high quality healthcare and formal care services by themselves. So this is lower their dependency on their children. And we expect that the difference in the health outcome of care provided by sons and daughters will be weaker among the wealthy parents. To answer these questions and test the hypothesis, and we use the 2013, 2015, and 2018 China Health and Retirement Longitudinal Study. So this study is focused on the nationally representative sample of older adults aged 45 and over. And because there is a significant difference in the subjective well-being between those who need support and who do not, and between the parents and the adults without any children, our sample focused on only participants who are receiving insurance support and have at least one child. So our final sample consists of 7,105 observations across 5,366 individuals after dropping the missing observations. Regarding the dependent variable, which is our focus of mental health, we use the CESD. The CESD index is developed to assess the depression by asking respondents how often they experience events and ideas linked to depression in the past week. The CHARS dataset provides a short version of CESD with 10 items. It includes 8 adverse events. It's including feeling bothered, depressed, fearful, lonely, desperate, tired, hard to concentrate, and restlessness. And 2 other positive experiences, the feeling hopeful or happy. For the responses, there are 3 categories. They are rarely or none of the time, some or little of the time, occasionally or moderate amount of the time, and most all of the time. So these values of the respondents ranging from 0 to 3 for adverse events and 3 to 0 for the positive events. And finally, the Likert scale for the CESD term ranges from 10 to 30. A higher scale represents more depressive symptoms. In other words, a higher CESD score will represent for a lower level of mental well-being. Regarding the care structure, the CHARS dataset collects the information on respondents' primary caregivers with the following question, like who most often help you with most of the ADL and the IADL tasks. The respondents are allowed to report up to 3 primary caregivers. So if they are looked after regularly by more than one person. In most other surveys, they only allow the participant provide one caregiver. So the child's data set itself can provide a more comprehensive about the care structure compared to other data set. That is also one of the reason we choose this data set. For the care structure, we group the respondents based on their relationships to the primary caregiver as follows. So we have the parents who cared for by their son. So that means at least one of the primary caregivers is the respondent's son, and none of the primary caregivers is the respondent's daughter. So similar definition for the group of people cared by the daughter. And we also have a group of people who cared by both the daughter and the sons, and the group of people cared for by other relationships. So we need to be emphasized here in the group who cared for by their son or their daughter, or their son or daughter may also receive support from other family members as well. For example, the siblings and their spouses. And to investigate our hypothesis, we use our equation 1. So simply for the left-hand side variable, which is the mental well-being, and we have dummies to represent who provide the care to the respondents, the son, the daughter, or both the son or the daughter, and the group of people who provide care by the others as the reference group. And for the control group, that's just all the other determinants we believe will influence the subjective well-being, which is identified in the literature. So it's including family structure, gender, age, education, marital statement, employment situation, and financial situation. So in this model, what we look at is actually the coefficient for the group of people looked after by son, and the coefficient for group people who look after by the daughter. So if here the alpha 2 is bigger than the alpha 1, so that means the group of the daughter who cared by the daughter will have a higher CESD score. In other words, more depressive symptom compared to the group people who are looked after by the sons. So if this happened, alpha 2 larger than alpha 1, then we will find the support evidence for our hypothesis 1. Now, as we said earlier, in our first group analysis, we have for example, the group of people who cared by son may also receive the care resources from siblings or the spouses. And for a robustness check, we only focus on the group of people who cared by the daughter or by their son. So in this case, we only to look at the alpha 1 will represent the difference in the mental well-being or depressive symptoms among the parents who are looked after by the son and those looked after by their daughter. So if the group of the people who look after by the son have a better well-being, and we will say the alpha 1 will be smaller and significant than 0. Smaller than 0 and significant different than 0. So table 1 is the data description for our sample. And in our total sample, as we mentioned earlier, we have 7,105. And the majority of this data set are women. Only 37% of them are male. The average age for the group is 64. So in other words, the average group of the older adults who start to receive support from the family is 64. And the married status is about 80% of them married, 15% of them are widowed, and the 36% of them, about 37% of them have finished their primary education, and the majority of the sample are in the rural area. And the household income, we can say, is about, it should be around £3,000 per year. And we can say the proportion for the group who are still doing the non-agricultural working is quite low. Only 8% of them still doing some non-agricultural working. The number of sons of the sample is about 1.6. The number of the daughters in the sample is about 1.5. And 10% of the family do not have a live son. and 18% of the family do not have a daughter. Actually, this is also one way to show you some preferences, and more families do not have daughter compared to the family do not have son. And the CESD score, which is a depressive term, is about 11.67. And we also have done some statistic comparison between the group of the parents who look after by son and the group of the parents who look after by daughter. And by the comparison, we can say in the group who are looked at by daughter, they tend to be younger and more likely to be married and less likely to be widowed, and more of the complete education, primary education, and are more likely in the urban area. And we can say that the number of sons in the group of people who look after by the daughter is less than 1, and it's more than 2 of the daughter in the family. And more interestingly, if we look at this group, is among the group of the family who are looked after by the daughter, about 43% of them do not have a son. But if we look at the group of the people who are looked after by the sons, about only 28% of them do not have a daughter. So this comparison also shows us in most families, they still, like a son, provide more care compared to the daughters. And here is a care structure, and this just looks quite complicated, but we only need to look at those three lines. So in our sample, we can see about 43% of this family received care from child, and about 56% of family do not receive care from child. And we can say among those people who do not receive care from child, the spouses are still the main care provider. But if we look at the participants who look after by the child, we can see 57% of them are looked after by the son, and only 22% of them look after by daughter. And we can see there is about 20% cared by both son and daughter. And this figure also discloses that sons are more likely to provide care to their parents than daughters still, even in the 21st century. Sorry. Oh, I'm sorry. I just saw the message from Sarah asking me to zoom in. I just tried to it seems I cannot zoom in properly. Please name sorry, I tried to share it again. I just saw a message about my slides probably not very clear.
Thanks, Yanan. If you can just
Is that better? Is that better? Sarah, is that better or not?
Yes, it is.
Okay, sorry. Okay, apologies for that. So this bit, it shows the results. If you remember, for our first model, we want to compare the coefficient for the group who cared by son and the group who cared by daughter. And we say if the coefficient group who cared by daughter higher than group who cared by son, we say the group of people looked after by daughter have more depressive symptoms. And now we can see there is a reference line, which is 0, and the coefficient for the daughter, which is positive, and the coefficient by the son, which is negative. And this result clearly show that the CESD score, which is the depressive symptoms, among the daughter, the group cared by daughter is much higher and significantly higher than the group cared by son. And then for our second model, which is represented for the results for the second model, and we want to say the coefficient for a group who look after by the son should be negative. And here we can see the coefficient is significantly different and smaller than 0. So we can get a conclusion that the group who are only looked after by the son have a significant lower level of the CESD score compared to the group who looking after by their daughter. And this is this is the group analysis, which focus on the This is a group of analysis which focus on the regional difference. And so for the first column and the third column is for the rural area. And we can see the coefficients for the care resource actually is not significant different from 0. So in other words, in urban area, the care source is not significantly associated with the mental well-being. But if we look at the rural area, and we find that care source does matter. Again, for the group who look after the daughter, they have a higher the depressive symptoms compared to the group of people who are looked after by the son. And then next, we look at the difference between mothers and fathers. In the first column and the third column, again, we didn't find any significant coefficients on the care source. So which means that the mental well-being of the older parents are not associated with who provide care to them. But if we look at the female, which is column 2 and column 4, and we say that among mothers, who provide care doesn't matter. And in general, the mothers who are looked after by the daughter have a higher level of the CES score compared to the group of mothers who are looked after by their son. So in other words, the care source only matters among mothers, but not among fathers. And for the table 4, which we look at the group based by the household wealth, and we can say the coefficient for the care source is not significant in the column 1 and the column 3. So care source does not matter for the wealthy parents. But if we look at the less wealthy results, which is column 2 and column 3, and we can find that the parents who are looked after by the daughter report a higher level of CES score again. And for the table 5, we just use different measurement, trying to find out what the mechanism behind the different. So we use the possibility to report the poor self-reported health, and the risky health behavior, and the social activities. And we found that the careful source actually is not relevant to the risky health behaviors or the social activities, but it comes from the self-reported health. And our findings for we have, now I just briefly summarize the finding for this study. And we found that, again, the older parents are benefiting more from the eldercare by the sons than the daughters in terms of having the better mental health. So we believe this is actually contributed partially by the son preference. So the sorry
to interrupt you, Yanan. You can zoom out now.
Okay.
Because you've got to the text bit of that.
Okay. I did zoom out. Now it's just like full screen.
Okay, all right.
Is that too much?
No.
It's just like it's cut in half, so we cannot see point 2. That's why.
But this is not in my computer. I'm sorry. Just keep doing that. Which exercise? No. It will be too small. The screen model.
Try to click on the plus.
No, does that work now?
Do you want to stop sharing and share again?
Okay. Apologize for this issue.
Yeah, way better. Yeah.
Okay. Sorry.
Now.
So we believe that this daughter advantages could come from the some advantages come from the some preference. We believe that the evaluating the support, the way how people evaluating the support is more influential to the well-being of older parents than how good actually the support is. So it's more like a psychological evaluation process. And the culture alone play a big role here. And again, we believe this is a gender disparity in the socioeconomic status, which determines the children's financial capacity to support their old parents. And we find the difference in the well-being of the old parents cared by sons and daughters is stronger in rural area. So in rural area, there is limited access to the healthcare, pension scheme, and other public support. And the son preference is stronger in rural area. This is because when the one-child policy was implemented in China, there is a different ways to how government implemented in both rural area and urban area. So in rural area, if the first child is a daughter, the household is allowed to have a second child. But in the urban area, the one-child policy was strictly implemented. So in the rural area, there's still a higher viability of a son compared to the daughter, which probably partially explain this stronger son preference. And also because the limited development in the economy and the infrastructure, the gender difference in the socioeconomic status is still significant in the urban areas, but it's closing in. Is still significant in rural areas, but it's closing in the urban areas, because it will follow in the modernization and the more rapid economic growth. And we found some advantages is stronger among mothers and the parents with less wealth. We believe the mothers and the parents with less wealth are more dependent on the children, so that is why we found a higher association between the care source and the well-being. So compared with the literature, this is consistent with the Chong and Silverstein, who show that older adults' well-being will benefit from the instrument support provided by their adult children if the support are from the actual appropriate source. But our results are different from the recent empirical studies, which show the evidence of daughter advantages in providing emotion and instrument care. So we think this could be different. This is caused by first the different sample, and the participants in the literature, they in general come from the 2002 and the 2011 China Longitudinal Health Longevity Survey. And for this group of people, they are much less likely to be impacted by the one-child policy. And also, in the different this literature use different measurement of primary care and health outcome. So as we said in the other data set apart from the CHARS, only one primary caregiver was reported in the literature. And so this could be underestimate the contribution by some. If as we said, the primary caregiver in general is provided by the woman, like a daughter and a daughter-in-law. And we have some implications for this research. As the China modernized, high educations for women will become more widespread, and the women now become more economically independent, and their structural ability to provide high quality care and the cultural acceptance of this care will increase. So this has really happened in urban areas of China, where high education for both men and women has already changed the cultural norms and the preference around daughter care. And this will go to spread to rural areas soon, we believe. So we expect to see a greater ability and acceptability in the daughter within all families. To support this transformation in rural areas, and our findings suggest that the key element to reduce this inequality is to lower in the dependency on the children. So this can be achieved by improving the financial independency of older adults. This can be realized by developing a comprehensive social security net, like healthcare, social care, and the pension system. Actually, in the past decades, the Chinese government has launched a series of reforms to ensure the universal coverage of health insurance and the universal non-contributory pension scheme. But the problem is that at the moment, because we just developed this welfare care system, so the current benefit levels of the pension and health insurance scheme are still quite low, as we mentioned at the start of this presentation. Another suggestion is developing the long-term care system by providing reliable, diverse, and affordable care services. At the moment, the provision of adult care service in China is quite limited. So we got a number which is quite old, is from Shanghai. Only 32.9 nursing home beds per 1,000 old person. And Shanghai is one of the most developed cities in China. This is caused by the lower development of the long-term care system. Partially is being contributed by the low quality of the care, no skill of work, limited tax service, and affordability. Also another important thing that older adults are reluctant to live in nursing home because they think it is a stigma which is violating the cultural expectations. So if older adults are living in the nursing home, the people will either criticize the older adults' children and think they are not filial piety, or they will believe there must be something wrong with these old adults, which make in which case, because nobody would like or willing to support the old adults, so it looks quite bad. So now this is the part of the reason why the old adults in China are reluctant to live in the nursing homes. And another important implication is getting the older adults to arrange their care and helping them understand the advantages of outsourcing care services. This is a very old study. I would like to find some new data, but maybe it takes more time. A report in 2010, it shows that a national study in China, only 16% and 20% of older adults in rural and urban areas were willing to live in a nursing home. The actions are actually required to enhance the social acceptability of outsourced care products and service, and encourage older adults to voluntarily seek the substitution of the care provided by their children. And also, it's very important to improve the financial literacy among older adults and help them to use the financial instrument to build this their pensions or their retirement saving. So there's also some limitations of this study. First, because the representative list of the child's data set it shows that our funding can only be generalized to Chinese parents aged 45 and over, and who already needs the ADL and IADL assistance. So with the closing gender gap in socioeconomic status and the deeper modernization, those who need care in the future may be less impacted by the source of care. So there's a cohort effect and very interesting to investigate in the future. Another limitation is that because the limited sample size, we are not able to distinguish the parents who were influenced by the family planning policies from those who were not. And also, our analysis could only be interpreted as causality under the assumption of a strict exogenous of care providers. Okay, so thank you so much for your time to listen to this presentation, and this is all for my presentations. And if you have any reflections or questions, please feel free to raise it up. Thank you so much.